The Institute of World Affairs at the University of Wisconsin-Milwaukee presents International Focus, a weekly discussion of the people and events behind today's global headlines. Support provided by Milwaukee Public Television and the UW-M Center for International Education. Now here's your host, Doug Savage.
Welcome to International Focus. As global concern, or in some cases panic, about the current Ebola outbreak continues, much of the focus has been on the danger the disease presents to populations here and abroad. Policymakers struggle to reassure their citizens that appropriate measures have been taken to limit and respond to the threat of Ebola. Much less light, however, has been shed on the underlying factors that contributed to the outbreak in the first place. Civil war, entrenched poverty, and a failing infrastructure have degraded the capacity of many healthcare systems around the world to contain a crisis like Ebola. Our guest today is a leading advocate for addressing global disparities in healthcare by rebuilding and expanding health systems in resource-poor environments. Dr. Aaron Buseh is Associate Professor at the University of Wisconsin-Milwaukee's College of Nursing. A native of Liberia, his research and teaching focus on ways to address the structural causes of health disparity that can contribute to crises like the current Ebola outbreak. Dr. Buseh, welcome to International Focus.
Thank you for having me.
Well, I'm wondering if you could start by giving us some sense of the state of the health systems in the three most impacted countries in the current crisis, being Guinea, Sierra Leone, and your native Liberia.
Yeah. I think that's a good place to, in fact, start. And I think we need to be very clear here and note that these countries have, very hardworking healthcare professionals. Some of them are very much dedicated. They work in situations and under conditions that many of us who are healthcare professionals will probably not appreciate working under. So yes, we need to be able to put that very clear that these are not just people who are just sitting back and allowing things to happen to their people. In fact, if anything, I think we want to look at those healthcare professionals, the nurses, the doctors, many of whom died when the Ebola outbreak first started in these countries. These are really people that we should admire and that we should appreciate, for the sacrifices that they made. The systems in these countries were even fragile before, the Ebola outbreak. All three countries, Liberia, Sierra Leone, Guinea, they are emerging from protracted civil war. In the case of my home country, Liberia, the civil conflict lasted for over 15 years. And what you had happening there was literally hospitals, being destroyed, healthcare professionals being killed. And I think the other thing that happened too was that you had a group of well-trained professionals, healthcare professionals that in fact left the country and could not return to the country, had to make living somewhere else and did not return to the country. So what you had happening after this civil conflict is that you have these countries trying to rebuild. In the case of Liberia, trying to rebuild, and they were doing fine, and they were doing just fine, trying to get their health systems back and operating. I know many of these folks are dedicated and committed people, but then here comes the ugly head of Ebola or some unknown disease that many of the healthcare workers did not even know and had no appreciation on what it is initially. And so with that coming into play and not having the system in place to address infectious diseases, they probably didn't know what they were dealing with initially.
So, obviously there's just the physical damage to the infrastructure, and there's poverty. But are there other sort of societal factors that come into play that keep countries in these post-conflict situations from getting their systems back in order more quickly?
Well, it's an issue of money. It's an issue of economics is an issue. So at the time these countries were emerging from civil conflict, of course, the global community too also began to face some financial difficulties. So I'm thinking about the loans that they get from the International Monetary Fund or from the World Bank. I'm thinking about some of those assistance they get from the United States and the European Union. As Western country faces more challenges than serves, of course, one of the things that, in fact, many Americans think that the U.S. government spends more on, international aid, and that's not necessarily true. So you got this happening and relying so much so on international community to support them without a solid base from which to continue to build makes it even more challenging to rebuild your hospitals. You have to train new healthcare workers because either your healthcare workers were killed or many of them fled and are living in different countries, in Africa or abroad, in other countries. So you have to train this new generation, and even having these facilities, the training facilities can be a difficult challenge. There are some other societal factors, and one of the things I have said all along is that Ebola also has, showing how we have all of these different healthcare systems that exist within these developing countries, especially in West Africa. We have the modern healthcare system that we use this biomedical approach that many doctors and nurses and other healthcare professionals are trained in. But alongside the traditional healing systems, or African traditional healing systems, that probably many Westerners do not know and do not sometimes appreciate. But those systems exist, and they've been existing for hundreds of years.
Well, I would think that they are much more accessible to more people. Yes. I mean, you may have a clinic some distance from where you live, yes, but there's probably someone much closer by that, yes, can provide those traditional services.
Absolutely, you're very right. So I'm thinking about in my neighborhood here in the United States, if I was to get sick at night, I can pick up the phone and call 911. And they can dispatch an ambulance to come and get me into the hospital. That's not the case in these villages and in many of these towns. There's no 911 to call for such a service. And so you have this traditional healer that is your 24-hour lifeline. So if you have a kid who has diarrhea, or if you have a woman who is pregnant and is in labor, you go and get the traditional birth attendants. That's how the system have operated. So we need to figure out somehow on how can we merge those two systems, because they are operating in parallel. So there has to be a way to get these two systems kind of merged somewhat.
And what about the element of trust? I would think the traditional healing person in your village is probably someone you're more comfortable with in many cases than the clinic that's populated with people you've never seen before. Yeah. Trust is a big issue in case of outbreak, especially infectious diseases, because in the case of Ebola, with people not knowing exactly what the disease is, and I have used the analogy before that just imagine waking up in the morning and pulling your blinds and seeing people walking outside your house in hazmat suit. You would panic. I would panic if I were to see such a stuff. Just imagine seeing people being carried into a tent, into a white tent, and not coming out, and somebody's coming back to you and telling you, well, your sister or your son passed away, and you not being able to see the bodies and stuff. So trust is a big thing, and when the public mistrusts the leaders, including the ones that are delivering the message, then it becomes a difficult process for you to get back on board and to get everything going smoothly as it's supposed to be. We've seen it time and time again in epidemics or in outbreaks, during natural disaster. And the way to gain this trust is to go back again in the community and
work with the leaders, the community leaders, work with the local people. In fact, I have said over the years that these local leaders they are reservoir of knowledge, that the modern healthcare workers or the policymakers may want to tap into. Was there another Ebola disease or some other disease in West Africa before this one? I know there was Lassa fever. There's another hemorrhagic fever called Lassa fever that is, found in West Africa. Because I know I saw cases in Liberia, and there are still cases in Guinea. So I'm thinking that, in fact, many of the healthcare workers probably thought they were dealing with Lassa fever first when this Ebola came about. Kind of almost mimic the same process, the high fever, the diarrhea, the vomiting, and then the end point would be all that hemorrhagic kind of stuff. That's what they are called, hemorrhagic fevers. So yes, they didn't know probably what they were dealing with. So I think building the trust and building that trust from the ground would be an important first step to promotion of any kind of messages for the population.
So do you think that's been happening? And we hear about Doctors Without Borders as taking a big role internationally. So when they go into a place, do you think adequate thought is being taken to engaging the local leadership, or is it we're the experts, we'll take it from here kind of thing?
Yeah, I think everybody knows that Doctors Without Borders is like the exception to the rule for many of these programs, because they usually don't leave even the community. So this is all going to be over, and they will still be on the ground, in some capacity. And the people see them, and they know what they are doing for them, and that's one way to build trust. And so
some of the other groups,
some of the other groups,
parachuting in.
Yes, and I use the phrase helicopter, researchers, helicopter people parachute in and they pick up what they can pick up and they leave and they come back, and they present that data and they go to conferences and they say this is what we do and this is what we do and that kind of stuff, and that's all good. But if you keep doing that, then what you do is that two things you do. One, I think you remove the sovereignty away from the workers, the local policy people, including the government. So we have to be careful here too with all of this aid that is being given, and all of this effort being made to contain it. That the healthcare workers in these affected countries must be able to participate fully. If you don't do that, and after 6 months, 1 year, you break down everything and you shut all the doors and you come back, well, the local population may be so used to what you've set up already, and they may not trust their own local healthcare workers again. They will say, no, those folks that came in from abroad, this is what they did. Now you guys are doing something different. So that sovereignty piece, and making sure that they continue, it has to be there, because, you can't have this constant aid. The local governments will have to be the one to pick it up. The government of Liberia, Sierra Leone, Guinea will have to be the one to provide health care to their own people.
Well, we're going to take a short break. When we come back, we'll talk a little bit about some of the ripple effects of an outbreak like Ebola. But right now, we'll take a short break.
The Institute of World Affairs presents our community with a range of public programs relating to global issues, U.S. foreign policy, and the world economy. For more information about the Institute of World Affairs, call 414-229-3220 or visit our website at www.iwa.uwm.edu.
Welcome back. We're talking with Dr. Aaron Buseh about fragile health systems. And, we talked a little bit about how the fragility of these systems limited their capacity to respond to the crisis. Now, let's talk a little bit about the vicious cycle that sets up. And what does the crisis then do going forward to these systems? I'm thinking like the flight, as you suggest, of some health professionals.
Yes.
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 Other kinds of things like farming is
Yes.
impacted by.
So I would think more about the economy too and farming. So the agricultural sector and also the economy. So many of these countries, the folks kind of rely on subsistence farming. So one way to contain Ebola is don't touch anybody. No large gathering. In fact, today, the president of Liberia, I think, just lifted the state of emergency this afternoon, saying that people can go about, but she still have the schools closed. So if people are not farming, not going to farms to make their rice farms and to grow other crops, then that becomes a challenge. In fact, the process of farming in a lot of these West African regions is based on a communal process. So we farm communally. That's what we do. So we all gather together, all 10, 15, 20 or more men in that village get together, and they go to your farm today, and we work on your farm. The next day, we go to the other person's farm, and we work. That's how we work together, and that's how many of these folks work together. But if you can't have this group together, then it becomes a challenge. So there's predictions from the World Bank that there's possibility that there will be some hunger to come after this whole Ebola epidemic is over, and that the GDP of these countries are going to be grossly impacted. So I think there will have to be some way to give some. So it's not just only let's give money to contain the epidemic, but you have to think long term too on some food aid or either some seeds to farmers to grow their crops, because they will not have seeds again to grow their crops.
So what about issues of governance? Do you think by and large the governments have responded as well as they could given the constraints?
Yeah. That's an interesting point that you just mentioned, because health is part of governance, and so good governance and a good government should also look at the health of the people as being part of this whole process. And I hate to sit from this distance and throw stone at folks who are working hard to keep these countries functional, given the limited amount of finances that they have. However, I think what happened in this instance is that many of these individuals who work for the government probably just didn't know what they were dealing with. Having seen it before, like I said, there have been few cases of Lassa fever, in Liberia, Guinea, in Sierra Leone, and they probably were just caught by surprise. But I think it cuts to the bigger issue of the global community. So, should we help these poorer countries to, in fact, rebuild their healthcare system in preparation for these types of outbreaks? Because today it is Ebola, tomorrow is, another outbreak, it's another disease. It is in Liberia, it is in Sierra Leone, it could be in another African country, it could be in the United States, it could be from a Latin American country. So I think the bigger question here is the global community and then prepare? And what can we do to assist these countries that have these fragile health systems? What can we do to assist them to rebuild their health systems for themselves, but also for the greater good of the larger community?
So that's you've just come up with my next question then. What should we be doing at the more basic level to make these systems more resilient?
Yeah, well, I was speaking to one of my colleagues' class just on, I think, Tuesday on Ebola again, and I was suggesting that the whole process of, thinking globally but acting locally is an important kind of process for many of these young people that are growing up. It's an issue of training. Can you offer some training to train healthcare workers, for instance? So you will need not just only doctors, nurses, but, you need people who are trained in information studies or information science. I'm thinking that CDC does a good work on tracking these diseases, but you need epidemiologists in those countries. You need people who can go out, and they are called virus hunters, and hunt for the viruses or whatever. People who are trained on how to track individuals who are infected. You need to put in people who, in fact, are sociologists, anthropologists, ecologists, and all of these folks all have to work together. So it's an issue of training. So it's not just an infrastructure, but I think it's not just only bringing them here and training them, but can you collaborate with some of these universities? So what's the role of these universities? So UW, Marquette, the Medical College, and all of these other universities around. What's the role? How can we help train these healthcare workers in these developing countries?
Well, and there are we touched on this a little bit before, but issues of sort of localizing the kind of care you're trying to set up and the kind of system. I mean, it may be that the very expensive hardware is not what a clinic in a village needs.
Yeah. Right? Yeah, so in a lot of these countries, unlike the United States that you have these 50 states, in a lot of these countries, there's what is referred to as this centralized structure, okay? So you have this centralized structure with the Ministry of Health in the capital city, that kind of like have the whole process set up. But you still need to be able to make sure that whatever you do, you create this network in a way whereby whatever you do can be connected back to the villages and to all of these points of care. Okay, so if you can do that very well, and I have seen some successful programs with maternal child health programs and diarrhea control, in which they train community health workers, village healthcare workers. We use some of those approaches here in the United States. I know I used to work with a professor in Chicago. We use some of that. Brazil has used some of those processes. Many African countries. It is a bottom-up approach and getting the people more involved in their health and well-being and determining their own destiny as opposed to this whole top-down kind of approach.
Well, you mentioned, places where it's worked. Are there certain comparisons between parts of our own society and some of the issues in the impacted countries we've been talking about?
Yeah. Well, I teach a policy course to the PhD students and the health system course to the undergraduate students. So I kind of like sleep in this thing, if you want to put it that way. And I like to see the politics involved, and around healthcare. Healthcare is one of those things that politicians around the world, not only the United States, but politicians around the world like to make noise about, but don't know how to fix it. And you would think that sometimes they should, in fact, listen to the people, but they don't listen to the people. And so that's a difficult kind of challenge to have there. But if you set up a system whereby the folks themselves who are going to use the system are not involved in determining how the system should operate, then it becomes a challenge. Okay, we learned one thing from the Dallas outbreak. I mean, not outbreak, but the Dallas case, with Mr. Duncan, the patient who had Ebola. One of the things that was suggested in there was that, and that you saw in there, is that these nurses got infected, And so nurses who are at the front line, for instance, should be also involved in trying to help to craft some of these policies and how these policies should look like. So if you were to take a look at the healthcare system in Africa, in these countries, then these villagers and these individuals at the grassroots should be also involved in determining what they want in their villages and how they want those programs to exist. Don't parachute in and drop in some expensive stuff and change and trying to see if you can change the people's culture. Leave the culture that if it's not causing harm, leave the culture alone and work within that domain on how best they can sustain their lives.
So at some point, one way or another, the crisis will subside and we'll be sort of in the post-Ebola period. So in terms of policy, what should happen then?
Well, I think you want to be able to sustain, and that's the thing. We are seeing this heavy response now from the international community, and that's very good. And I really am appreciative. As a native of Liberia, I'm appreciative, especially of the U.S. government, sending the troops over and the amount of money that is being put into addressing the issue in Liberia and the other countries. The issue becomes then, how can you sustain this process? Not only funding, but again, I hate to keep singing this song that there will be another outbreak. So what should be done? If you take a look at the West African belt, that whole West African region is made up of about 16 countries or so. if you take a look at that West African belt, there's a group called the Economic Community of West African States, ECOWAS. In fact, ECOWAS was instrumental in pulling together a military force to go to Liberia to help to stop the war in Liberia. And so can we move health as being one of the major agendas into being addressed, and not just the economy, but also health can become an issue. So that's kind of regional, and I think many of the efforts should get some real support for this regional effort to be able to address it, and not just total reliance on the developed countries alone. You don't want that happening, because the African countries also need to be able to address these issues amongst themselves. So
medicine works best when it emanates from home.
Yes.
Very good. Well, we'll have to leave it at that. Aaron Buseh, thank you very much for being with us. Our viewers, we'll see you next time on International Focus.
Thank you.
For information about the Institute of World Affairs and its many programs, or to become a member of the Institute, call 414-229-3220 or visit us at our website,